Over the last 24 hours, we have identified 1,413 new cases in Alberta and completed about 19,500 tests. This means our positivity rate stands at about 7.4%. There are currently 759 people in hospital, including 141 who have been admitted to the ICU. Sadly, 25 new deaths have been reported to us in the last 24 hours. My thoughts are with everyone mourning a loved one right now from any cause. I know the current restrictions impact how you can grieve, and I urge you to seek support in whatever ways are available to you. COVID-19 impacts us all. There are currently active alerts or outbreaks in 443 schools, or about 19% of schools in the province. Currently, these schools have a combined total of 1,971 cases. I know this has been yet another tough week for many Albertans, a difficult week in a difficult year. However, we are starting to see some early positive signs in our province. On Tuesday of this week, there were 1,286 new cases of COVID-19 identified. That was the lowest daily total since November 26th. As of today, there are 19,607 active cases in the province. That is the lowest it has been since December 5th, 2 weeks ago. Our provincial positivity rate fluctuates on any given day, but is on a downward trend from the high of 10.97% on December 3rd. Now I want to be clear, our fight is far from over. We expect that hospitalizations and ICU admissions will continue to rise in the coming weeks, as these are lagging indicators, meaning that it takes several weeks before changes in our case counts are seen in the demands felt in our acute care system. Our health system continues to feel the strain, which will increase in the days ahead. But what these numbers show us is that together, we have the power to protect our communities and to change our future. We must continue to do everything possible to protect the care system that we all rely on. I know that a great many healthcare workers are working incredibly hard these days and will be working all through the holidays. I am grateful to all of them and to all frontline workers. It is for them that we must maintain our progress. In the past, we have seen COVID-19 cases level or dip before, only to rise again. The positive indicators we are seeing can be reversed in a matter of days if we all don't keep doing our part. It is up to us to continue this momentum. With the weekend upon us, I'm asking all Albertans to remain vigilant in following the restrictions in place. The positive tests that have been identified at the World Junior or within the groups are the result of the very strict protocols that are in place for regular testing and quarantining before the groups start to come together to play. So those tests are a result of the system working, identifying those who are positive, making sure that they do not have the opportunity to spread to any others, and making sure that the bubble is maintained. And so once people have gone through that quarantine period, have had those tests, making sure that they're not potentially going to introduce the virus, only then starting that activity. I absolutely recognize that there are many in Alberta right now who would love to play hockey, who would love to play a team sport, or do another activity that currently is not permitted under the current restrictions. What I looked at when I was asked to consider whether or not the tournament should go ahead, the World Junior Hockey Championship, primarily my job is to protect public health, and I wanted to make sure that the protocols that were in place were rigorous and would not cause any risk to the public, and I'm confident that that is the case. When then considering again the challenge of allowing or not the tournament to go ahead, that was a judgment call because I know that many people also get joy from watching these kinds of events. And so once satisfied that that would not cause harm to the public, I did make the decision to allow it to go ahead for the purposes, again, of providing some entertainment to those who are unfortunately not able to engage in those sports at this time, But what I will say is the measures that are in place are, again, starting to have that early positive effect. And the more that we can all work together to bend the curve down, the more likely it will be that we can start to ease these restrictions in January when we hope to do so. So our best chance of all getting back to those activities that we love, likely with still some measures in place, our best chance of doing that is to keep on with the actions that restrict the spread of the virus so that we can all enjoy those activities in a safe way when the time comes to assess the measures again. Between July and October alone, 449 Albertans died from apparent unintentional opioid poisoning. My heart goes out to all who have lost a loved one. It is a sad reminder that while COVID-19 is a serious and deadly pandemic, it is not the only public health crisis impacting our families and communities. I ask Albertans to show compassion and support to those dealing with substance use issues, their family and friends, and to all those grieving the loss of a loved one.